Hello, everyone. Good afternoon and welcome to Basics of Advanced Care Planning. I'm Amy Dahlman with Dancing Sky Area Agency on Aging, and we cover 21 counties in Northwest and West Central Minnesota. And one of the things that we do is we partner with wonderful organizations like Hospice of the Red River Valley to bring you educational webinars. And we do these at least once a month, if not more often. And this month, we're really excited. We're having Stacy Metzger from Hospice of the Red River Valley. Unfortunately, her co-presenter, Chelsea, that was planning on being here, she has a sick child, so isn't able to take part, but we have Stacy, so we are confident we are well in really good hands. Let's just say that. So Stacy Metzger, she's been with Hospice of the Red River Valley since 2014. She began as the team social worker and has transitioned into the lead social worker. And she currently provides clinical supervision and support to social work staff and volunteer coordinators. And Stacy has her master's in social work and is licensed in both Minnesota and North Dakota. And then she's going to tell you about a special certification that I cannot remember, even though she just told me that I'm going to have her expand on, and then she will get into her presentation.
Sure. Well, thank you, Amy, for that great introduction. And I am very excited to be here. I'm very passionate about advanced care planning. The certification that Amy mentioned is I have an advanced palliative and hospice social work certified, and I was actually one of the first in the states of North Dakota. So it's pretty cool accomplishment to be one of the first to get that extra certification. I should also mention, prior to the pandemic, I also was a instructor for First Steps, and that would be for advanced care planning as well. And so I went through a couple-day training down in La Crosse, Wisconsin, to be able to be an instructor. So I've been teaching on advanced care planning now for, probably since like 2017. But we just haven't offered any of those classes to become an instructor. So I do have quite a bit of knowledge and information on advanced care planning. So thank you for having me. Like I said, I'm excited to be here, and I really do enjoy talking about, your planning for your future and really having good, solid things in place. Uh-oh, Amy, it's not wanting to go. Oh, there we go. So I like to call it being the captain of your ship. It really empowers you and it gives you the resources. Having those conversations, having those documents completed really are your wishes. So when you have everything in place, you really get to drive your own ship. So making sure that you've got any of your documents completed, like I mentioned, having the conversation with your loved ones, with your friends, whoever it may be, so they know your wishes. So you can really drive what your healthcare will look like if you're not able to speak for yourself. Some of the common words that you may hear for like a healthcare directive would be that healthcare power of attorney, power of attorney for healthcare, living will. We at Hospice of the Red River Valley tend to use the honoring choices forms. Both Minnesota and North Dakota do have copies of the honoring choices forms. They're free to print off. They have a short form and they have a long form, but really any type of document that you use for your healthcare directive, as long as it's complete and it's been either notarized or witnessed, will be good. And so just know that there are definitely different names that people use when they're talking about their healthcare directive. We call them advanced directives here at Hospice of the Red River Valley. So if you do get admitted to our service, that's one of the questions that we ask right away is, do you have an advanced directive? And then we leave it up to our social work staff to, review it. If you want to complete a new one, we can help you with that. If you don't have one, we would encourage you to sit down and think about what your healthcare decisions would look like. There is a difference, and this can be really confusing at times. I've heard over and over people say, oh, well, I'm the power of attorney. Well, power of attorney is really related to your finances and property. And so there's times when I'm looking at the forms, or when I did look at the forms, where they'd be like, well, I've got the power of attorney paperwork. And I would take one look at it and be able to say, well, actually, you're really the power of attorney of their finances. So you really don't have that ability to speak for them on that healthcare side of it. And so when you are reviewing or completing your advanced directives, just know that language is really important. And so with a healthcare directive, that is going to be for healthcare purposes. Power of attorney really deals with the finances. Now, there are some forms, that will say power of attorney for both finances and healthcare, and that would be okay as long as it's very clear that it is covering both finances and healthcare. But we're finding that more and more people are having separate power of attorney paperwork for healthcare and finances, just because it makes it a lot cleaner, a lot easier for people to, to look at, to review, if that time does come, when a healthcare directive is needed. Oh, please feel free, if you have any questions, ask them right away, so then I can get those answered rather than waiting till the end. And Amy's going to help monitor if there's any questions that come through. So please ask away. So who should make a healthcare directive? Really anybody who's over the age of 18. And as long as they have that capacity to understand, what the decisions or what the choices that they are making. So soon as somebody turns 18, we would definitely encourage that person, to really have that directive, because we just never know, when something would happen, to a person. There's no guarantee of tomorrow. There's no guarantee that, any of us wouldn't get in a car and maybe get in a car accident. And it's great to have those decisions already made in the time where maybe you can't say what your wishes are. It's important to know that capacity, though, it can be very fluid. And so it may change throughout the day, the week, or the month. And so when I am working with our social workers and helping them understand advanced directives, one story that I think of is we had a gentleman who didn't have a healthcare directive, and he didn't have somebody listed as his healthcare agent, which I'll get to next. And so we had no one to turn to when decisions needed to be made. And I encouraged the social worker to visit a couple times throughout a day during a week to see when the person was clear and could understand, what the choices were and what his options were. And we found that mornings were the best time for him. And so she went in, had a conversation with him. And what our biggest piece of that was just determining who that agent was that would be able to make those decisions when he was no longer able to. And so, if somebody does have very advanced dementia, advanced Alzheimer's, that's going to look a little bit different. But like I said, if you're just having, that minor memory loss, and, you find that you are much clearer in the morning, or maybe in an early afternoon after you've had lunch, or maybe a little nap, finding that time when you have that clearest capacity to make those decisions. So getting back to what the healthcare agent is. And so this is an adult who you have chosen to be basically your spokesperson. And that would be if you were unable to communicate your wishes yourself. And that's why I feel very strongly that everybody over the age of 18 should really have a healthcare agent advanced directives completed. Like I said, usually it's in a crisis when these decisions need to be made. And so having that agent available to be able to share what your wishes are, is truly a gift. And I talk a lot about with the families I've worked with is, advanced care planning is a gift that you're giving your family. You're not leaving your family to make those decisions on their own. You're not leaving your family
Matthew, anong number ng daddy mo? 403?
You're not leaving your family to make those tough decisions, maybe in the hospital. You have this gift that you're leaving them by completing an advance directive. And so the role of the agent is just to share your wishes, to make your wishes, to make your goals known once you do lack that capacity. And so when I've trained our local EMT and firemen, we talked about how if you arrive at a home and a person is able to say, yes, I want treatment, or no, I don't continue on with this, that person still has a capacity. And those are the wishes that must be followed. And then we talk about if they arrive at a home where the person is maybe unconscious, unresponsive, not able to make their wishes known, that's when we would turn to this agent, and the hope is that they would communicate, to that medical provider, whoever it may be, what your wishes are. So choosing an agent is extremely important. I always have encouraged people to list one person as an agent. Language, again, is very important when it comes to how your agents are listed. So if you list, say, maybe you've got two children, and you say, I want to list Stacy and Amy as number one, then what happens is we both would have to agree if a decision needs to be made. Now, if I list Stacy or Amy, then it could be either or. However, again, I always try to encourage people just to put one person on that line. And then you have the opportunity to list a second alternative and then even like a third person. So on most forms, it has like your primary agent. And then afterwards, there is space for, like a number 2 person and a number 3 person. I think back to a family that I worked with, maybe, a younger gentleman who had 3 adult children, and we were talking about healthcare directives, and it got to the point where there was actually quite a bit of arguing between the 3 daughters about who was going to be number 1. And I had to pull out my best mom voice and really stop the arguing, because I had to just tell them, it doesn't mean that dad loves you more, or it doesn't mean that you are the favorite child. What it really means to be that agent is they can trust you to make your needs known. They can trust you to share what your wishes are. If you were unresponsive and not able to make your needs, to make your goals, wishes known, and you are the agent, there's really no law that says you have to follow what their wishes are. So if you don't choose a person that you're confident in or that you trust, they may not follow your wishes. I know, for instance, in my family, I'm the oldest of 4 children, and my parents have listed me as number 1 just because they know that I would be able to probably separate my feelings from what their wishes are, versus my second or my third sister in the family. Oh boy, I think, she would probably leave my parents on life support forever if that was an option. But that's part of being that agent, is able to separate your own feelings, your own emotions, and really make the decisions that you want as a person. And so, do they understand your wishes? Are they going to be able to make those decisions? Are they able to make those decisions under stress? Again, advance directives usually come into play when it's a stressful situation. So who may be appointed a healthcare agent? So you have to be somebody who's over the age of 18. It can't be the person who is the one that's going to determine that you cannot make that decision-making, ability. And so that would be, a physician, a doctor, somebody who would help make that decision. It can't be that healthcare provider. And then it also cannot be the employee of the principal's healthcare. So the principal would be you, the person who the healthcare directive is about. So it cannot be a employee of the healthcare unless, of course, it's a related by blood, marriage, partnership, or adoption. So just so you know, somebody cannot be your agent if they are within like that healthcare position. So I cannot be anybody's healthcare or healthcare agent if they needed somebody, if they maybe had no local family, no local friends. I would not be able to be an agent, say for a patient of Hospice of the Red River Valley. And again, the most important thing you want to think of is who would be the best person to serve as that agent. And, you know, it may take a lot of thought, you know, it may take a lot of conversations, you know, with your loved ones in your life, you know, having that conversation, you know, we got Thanksgiving coming up, you know, have that conversation with your family about, you know, if something were to happen to me, you know, who would be the best person to, you know, share those wishes or my wishes. So what decisions does a healthcare agent have? Any care, any treatment, you know, if you want to have any, you know, on the ventilator, anything that would be considered a healthcare decision. They also can choose the healthcare providers, where you would live, what kind of care support. They also get to review any type of medical records. So the agent has all of that responsibility for you once you have determined that they are your healthcare agent. They also have the ability to establish that personal security safeguards, so they can say who can visit, how long they can visit. So as you can see, this is a pretty long list of things that the healthcare agent may have to make. And so again, putting that thought, putting that time into who is going to best serve as for you. And actually, I've worked in hospice since 2014, and there are times when it's maybe not even a family member. It's a close friend, somebody that they know that they can trust. So it doesn't have to be family, it doesn't have to be a spouse, it doesn't have to be a child. Sometimes it might be a cousin who you're close with, or a next door neighbor that maybe you've lived in the same, you know, at the same home or the same apartment or on the same street, you know, that you feel that you could trust the most. And sometimes people want to just remove their family altogether from having to make those healthcare decisions. Because like I said, it could be a lot of stress. I've heard of numerous family members who have gotten into arguments about, how do you know mom wants that? How do you know dad didn't want to try harder? How do you know we shouldn't have done this? And so sometimes people are said, I just don't want my family members to be involved in that. I want to leave this up to my next door neighbor, Amy. I feel like I can trust her. She knows me. We have coffee every day on the back porch. And so you got to really think about everything that comes into having that healthcare agent. Again, the healthcare agent just has that authority to medical records as well. Again, responsibilities of that healthcare agent. You know, that healthcare agent, like I mentioned before, doesn't necessarily have, oh, Amy, I see some questions. I wonder do you want to see if they are, let's see. Oh,
No,
you just wrote that in there. Sorry.
Oh.
I just saw 3 pop up on there.
Oh, sorry, those are all from me.
Yeah. So again, the healthcare agent necessarily doesn't need to follow your wishes, your goals, your advance directive that you've completed. But we do, if they choose not to, but we are asking that healthcare agent must act in good faith. And we hope that they would follow your decisions in that advance directive, you know, just because that's what you've put together. That is what your goals are. And if you don't have one, then they just have to act on the best interest of the principal, and, you know, really think about, again, who you're appointing and who you are choosing to be your representative if you can no longer speak yourself. One thing I would like to add about So with Minnesota, there is no order of priority, which means if you don't have an advance directive completed and an agent listed, and let's say something was to happen to you and we couldn't contact a family member, or maybe you don't have any family members, the law actually states that we would have to go through a guardianship prior to any decisions being made. And so that with that comes a lot of additional expenses. It's time consuming. And so if you are on here thinking, gosh, I really don't have anybody, or I can't, or I don't want to complete one because then I got to think about some of those tough choices. Just know that on the Minnesota side, if you don't have somebody or we can't identify, somebody legally, it says we have to go through a legal guardian. And so, for instance, with hospice, we've actually had a few hospice patients who we've had to delay admission to hospice care due to them not having an advance directive, an agent, or family who we were able to contact to get that signatures and to get that consent for hospice. If you live in North Dakota, they do have what's called the order of priority, where if you don't have an advance directive, they would look at spouse, adult children, and so forth until they could find somebody to make that decision. But again, an advance directive is definitely a gift. I would hate to be, get a phone call at even 8 o'clock at night saying, your parents were in a pretty severe car accident. Now you got to come make these decisions for us. With my parents having one complete, I know what they would want if they were in a situation where they weren't able to express their needs or their wishes.
Stacy, we do have a couple questions now.
Okay.
So the first one is from Cassie, and she's just wondering if we will get copies of the slideshow at the end. So Stacy, if you're able to email me the slideshow, I can send it out to those that attended.
Okay, yep, I can do that. Yep.
Perfect. All right, and then the next one is, what if you are the second on the list as the healthcare agent and you were told that the first person, and in parentheses it says my dad, should not make any legal decisions anymore?
Right. So in that case, I'm assuming, and correct me if I'm wrong, I think I'm reading the question now. So is the person whose advance directive this is, are they still able to update their advance directive?
Yes, this is Deborah Trixton.
Okay.
Yeah, I think she could, but at one point she wasn't able to. She was kind of in a really confused state. And that's when we were looking at these decisions, but now she probably could again.
Okay, so Deborah, in that case, I would have maybe sounds like your mom. Your mom complete a new advance directive, and then just kind of moving everybody up on that page and removing your dad from it. I'll talk in a little bit about how often you should review and update your advance directives. That's a little bit towards the end of my slide. But if you do ever revoke a current advance directives, my advice to you is shred, burn, get rid of it, write void over it, whatever you need to do. So if it were ever to surface again, you could say, nope, I've got an updated one. And in healthcare, we actually, if there is multiple floating around, then we would go by the one with the most current date on it. And so if you got one completed today and the other one was made 15 years ago, the 15-year, we wouldn't even touch the 15-year-ago one. We would look at the one with the most current date.
Okay, thanks.
Yep, you're welcome. Okay, a few other considerations. Oh, now my slideshow's not wanting to move again. Let me try. All right. So a few other considerations, to think about as a person that is completing advance directives, is this life prolonging treatments, CPR. And I don't know how many people are familiar with, everything that goes on with CPR. And, it's not like what we see on TV. You know, you just don't do a couple light little pumps on their chest and then you jump up and you go finish running your marathon or go and have brunch with the friends. You know, it's very traumatic. And I mean, I don't want to be the person to, you know, like scare anybody away from ever choosing CPR. I think when it's done in the correct form, in the correct place, at the correct time, it is very life-saving. We just know as people age, it's a little bit harder on a person's body. And if it's done correctly, you are breaking ribs, you know, because you have to get down there and you have to be able to complete enough pressure, you know, to get that heart beating again and really to get things moving. And so having those conversations, having those time to just think about, you know, what would I want? And it's going to change as we get older. These decisions are going to change. And so I'll talk about that here shortly on how often we should be reviewing our advanced directives. Some other things to consider as you are completing advanced directives and writing them up. What kind of pain management do you want? Do you want aggressive pain management? Do you want to still be maybe lucid enough to be able to have conversations with your families? Ventilation, you know, is that something that you would want, or do you want to just not have to have any of that? Dialysis, antibiotics. We know that use of blood products are prohibited in some cultures. I see another question popped in. So
Yes.
So is DNR included in this, or is it separate? We will talk real quickly about that here shortly in the DNR, but yes, so in advanced directives, that would be something that we would put in there. We also use like a POLST form, and that's a physician order for life-sustaining treatment. And that would just say yes or no to a do not resuscitate. And then of course, if they are admitting to hospice, we do ask everybody at admission, and that's a requirement if they want to be a do not resuscitate or not. And so we call it a code 1 or a code 2 in our language. And we would ask that from everybody. But that is definitely something that you could easily and you should be including in your advanced directive. And so some like the end of life. So if you are, do you want to be attempted to have extreme measures to bring you back? Any type of mental health concerns, what's important to you, faith-based values, beliefs. I don't know why my computer is being silly again. Organ donation. That's another important piece of advanced directives. Do you want to donate your organs? Do you want to donate your body to science? UND has their body deeded program. University of Minnesota does some brain, studies, so you can donate, parts of your free body for science. And so is that something that's important to you? Do you want an autopsy? Again, the do not resuscitate. So it says it's not the same as a healthcare directive, but you can definitely include that on the document if that's something that your wishes are, that you don't want to be resuscitated. And then pregnancy. So like I said, this covers, it's not just an end of life piece. It is covering decisions that may look different in your 20s, maybe in your 60s. And so that's why there is that recommendation that we do update them and we do keep them, current as possible. So when does it become effective? It does become effective as soon as it is signed. And so when it is signed, it has to be notarized or 2 non-relative witnesses. And so that could be 2 neighbors of yours. That could be maybe a significant other of somebody in a family, but it just has to be somebody who basically says, yep, I'm witnessing the signature as Stacy Metzger. That's who she is. Or it can be notarized. It does not have to be both. And then it's so important to remember that as long as the principal has the capacity to make the healthcare decisions, those trump what, say, like that healthcare agent would maybe say. And so there are times, again, in my practice where I've had people say, well, I'm the healthcare agent. I don't want mom to have morphine. Well, guess what? Your mom is competent. Your mom has a capacity. She is requesting morphine to help with her pain and her breathing. And so those are whose decisions and whose wishes we're going to follow. So really the healthcare agent doesn't become effective until that person is no longer able to make their needs known, or they lack that capacity. And usually when they lack the capacity, it's the physician is making that decision. And there's a lot of times, honestly, where you have your healthcare directives completed and maybe you never ever have to use them. And I think and people will say, well, then why will I want one? Why would I need to complete one? Well, we would rather have everybody be safe than sorry. Again, it's a gift that we're leaving our family, our friends, whoever it may be. Healthcare directives also, I've lessened the, maybe the arguing between the family members, between the siblings, between the brothers and sisters, because now I've got this nice, clean, neat document that says, this is exactly what I want. This is what I don't want. And if the time does come where that directive needs to be used, I mean, there shouldn't be any arguments about it. There shouldn't cause that tension in the family waiting room if you're waiting for so-and-so maybe to have surgery, so-and-so not to have surgery. And so hopefully by having this done, it does decrease that stress. It does decrease maybe like the tension, because everybody should be on that same page and know exactly what you want.
Stacy, can I ask you a question?
Of course.
So as far as the witnesses,
Yes.
could it still be a family member who's not listed as an agent? Could that still be a witness, or is that not allowed?
We really encourage to find like two people not related. There are times, when I've had to run across the street in Moorhead one time just to find a neighbor that could sign off, and I had them be number one, and I did sign number two, just because we were on a time crunch and we needed to get an advance directive completed. But we would ask that if you had time to find people that are disinterested, in what's kind of going on. And so like if you're living at a facility, maybe there would be the person at the front desk could vouch for who you are, and a neighbor. So try to find those ones. And again, the ramifications of that would be, would it hold up? If anything ever went to court, it just depends. But we would encourage you to do that. Having it notarized would be your best option, to have, a notary, but that we know that people are home, housebound, they're not able to get out, especially now that we got winter, the roads are horrible to drive in. So two non-relatives is what I like to tell people, but a notary would probably be best. So the requirements for them to be valid, we talked about the notary, the witnesses, it has to be in writing. So even though I have told everybody what my wishes are, it has to be written down. It has to be dated. It has to have the principal's name. Again, the advanced care directive principal is who the advanced directive is about. We also wanted to include who the healthcare power of attorney is. And then once it is, and then this one says a photocopy of a healthcare directive is presumed to be true and accurate. And that is correct. So once you complete your advanced directive, we actually ask and encourage you to make multiple copies of it. But remember who you're giving your copies out to in case you update it, so then you can give them an updated one. So you're never going to want to go, okay, got this done, safety deposit box. That's where I'm leaving my advanced directive. You're going to want to have that document with your primary care provider. Make sure your agent has a copy of it. If there are other people in your family that are invested in your health, make sure they have a copy of that as well, so they know exactly what your wishes are. I even said, put it on your fridge. So if you maybe are moving towards end of life or you're on hospice, have those documents available. So if an emergency does come up, then you have easy access to them. Throw them in your glove box. So if you are out traveling, have them in your glove box in case, something were to happen. If you go on a trip, throw it in your suitcase. Just know that a copy is considered true and accurate, and it is treated as the original. Another question that I get when I talk a little bit about this slide is, so let's say I'm a Minnesota resident, but I go down to Arizona for the winter. Are they going to honor my Minnesota advance directive? For the most part, yes. If you were going to be down there, let's say just for a couple of months, there's no need for you to have to, make a new advance directive or complete a new one. If you're going down there and you're having a very extended stay, you're going to go down for a couple of years, I would encourage you then to, get in contact or find like your local or the state advance directive with the state that you're residing in. But for the most part, they would honor advance directive from another state. Minnesota, North Dakota, they will honor them, no problem if you're traveling over here. And I've worked with a number of patients who have come to us from a different state, and we would honor their state one here as long as it was legally, it was legal and it was written down and everything in this slide.
Stacy, there's another question.
Yep.
Question is, if it is on file at a hospital, do you still need a physical copy, or is this just another good place to have it?
I would say that's just another good place to have it. I would always keep a physical copy on, within where you can find it. And that's why I always suggest that you as a principal keep your original copy and you give everybody else the originals. And then say I completed it in my 30s and now I'm in my mid 60s and I want to redo it. Maybe I take out my one from earlier and I just maybe want to put some notes on it, like what I want to do different. And then I would get a whole new form and complete that form. And then I would make copies of it, keep my original. And then again, give it to my primary care provider, make sure my family has an updated one, and let people know that if you do change things, and maybe your agent's going to change over time. Maybe at one point I'm like, yep, I want everything. Keep me alive no matter what. And now, maybe I'm not quite that extreme, but I still want a little bit of that, or I still want, this done. So this is really, we want it to be basically a living document that will change over time. And so I think I read one from like 1988 one time, and I was like, whoa, like it's a little old. Do you want to update? And they're like, nah. And their agent, one out of the two was no longer living, and we ended up just doing a real quick short form for him. But it's kind of funny. I was like, well, I'm sure something has changed. But oh yes, okay. So the revocation of a healthcare directive. So at any time you can revoke all of it or part of it. Again, if you do decide to change anything on it, make sure you have void on it, burn it, shred it, just really get rid of it. And then again, you'd want to make a new healthcare directives. Like I mentioned before, if there are several healthcare directives, the most recent one is the one that is actually going to be followed. So, my little chat box came up. Sir?
Yes. So the question is this a new item on the healthcare directive that you have to have it witnessed or notarized to be valid? I have clients that have one, but no witnesses on it, and it is signed by the client.
So legally, it has to be witnessed or notarized. If it was completed by like an attorney, it probably would have already been notarized. But I would encourage this person, if they're able, to complete a new one, just because, who's to say that I was mad at Amy for some reason. I mean, and I wrote up a healthcare directive and signed her name saying it was legally binding. So yes, and I have a copy of the healthcare directive that we use for Honoring Choices Minnesota that I will show here shortly. It's kind of small on my screen, but at least you'll get the gist of what it looks like. But yes, I would definitely encourage your clients to complete a new one and make sure that they don't sign it until they're in front of a notary or the two witnesses. Does that
Yeah,
answer your question?
it does, but I know this people did sign it. It wasn't coerced in any way, shape, or form. And I just
Sure.
remember, I don't remember this ever having been where you had to have it notarized. It's hard
Okay.
enough to get them to do a healthcare directive than saying forcibly, you have to have this witness or
Right.
notarized to be valid. You know, I would rather not even tell them that part. If at least we have something in front of us that says, you know, their choices. I just don't remember that being an enforced thing. I remember it being a nice thing, but not that it makes
Sure.
it invalid.
Sure. You know, and I guess for as long as I've been doing this since 2014, that's always been part of it, is the making sure that it's notarized by two witnesses or notarized or witnessed by two non-relatives. So, Deborah, I do see your question about a person who is taking care of someone as a CNA or nurse. So what I would encourage for that one is if you don't have two people, like disinterested people, I would definitely find one person that is, so maybe like a neighbor or maybe a friend of yours, Deborah, that could come over. And then, yes, you could have number two be a nurse or a healthcare or a CNA, but I would put that as like last option, but you could, but I would always put number one as, you know, say, you know, that friend or a neighbor, and then use that person as number two. Again, we've signed them in very rare instances. That's something that we don't practice at Hospice of the Red River Valley, is signing as a witness. We do have a couple notaries on staff that can actually go to a patient's home. But there are times, yes, where we've been in a pinch and we've had to sign, but we've always signed as a second witness. So then, I mean, we're acting in the best interest of the patient, of the principal. And so if it ever was, if anybody ever contested it in court saying, you know, this person was the nurse of, you know, the principal, you know, we would feel pretty confident that we said, well, you know what, number one is Deborah's friend. She, you know, reviewed it. And so then but yes, so sorry, long answer long answer for you is, you know, sorry. Yes, you can. Kind of went around along with that one, but yes, you essentially could, but I wouldn't make it a common practice to have, you know, somebody in that healthcare role be a person signing.
Well, I have to update my mom's in, you know, right now, actually, you know, because of the thing with my dad, he's really not supposed to make legal decisions anymore.
Sure.
And she's in the hospital. So,
okay.
So that's why I just thought, well, who could I get? But maybe they would have a notary that would.
I bet they would have a notary. They probably have a couple notaries on staff that can do that.
Yeah, so that was my reason for that question. Yeah, thanks.
Yes, so that would be a great, yeah. Usually your facilities have a notary on staff in your hospitals. Most nursing homes, some assisted livings are a little bit trickier, but usually at some of those places you can find somebody. Maybe it's the housekeeper who has come in and visited, you know, helps clean your mom or dad's room up. So again, we would encourage to find two non-relatives or non-people that aren't, you know, invested in that care. But if you can't, do one and then do the second person as like that nurse or that CNA. So, oh gosh, I'm running out of time already. So again, we use Honoring Choices in Minnesota and North Dakota. There's also the POST form, which is I guess it's changed to the Provider Order for Life Sustaining Treatment. And 5 Wishes is another common form that we have used. And again, that one you can find online. Honoring Choices, Minnesota, North Dakota. I know Sanford uses that one. I believe Essentially uses one similar to that one, if not the Honoring Choices one. And then the PULSE form is something that is completed and signed off by the provider. And on that one, you will see that DNR. So this is like the short form for Honoring Choices. I apologize, it's kind of smaller if you can't see it, but what it is, and so it says your full name, your date of birth, and then here it's saying that I appoint this number 1 as like the healthcare agent, and then you have the option for number 2. And then here's where you can write in anything that you want done about your healthcare. So on that number 2 where it says optional, but really if you don't have any wishes or you don't have anything you want to have in writing, you could just list that agent. It's not going to be probably the best advance directive that I've ever read, but at least it's going to give your medical providers a person to turn to if they need to ask any questions or you need any decisions that need to be made. Here is the notary, the witness statement, and on the back page, it just talks about how you can complete it, the notary, the witnesses, and then there's a space where you can write anything extra where you would want about your healthcare. All right, I see another question that came in. Oh, this is Amy
Actually, it's
again.
just me. I just put the statutes reference out there in regards to, it mentions like who is ineligible to act as a healthcare agent, who is
Perfect.
ineligible to act as a witness or notary, but it does mention both the witnesses and or a notary. So.
Yep. Yep. And even on the back form of the Honoring Choices, it does say a notary or 2 witnesses must verify the signature. And then it does say that at least one of your witnesses cannot be the healthcare provider or the employee of a healthcare. Like I said, we don't make it a practice to be number 2, but we will if we need to in a pinch. So again, and I've got copies I can get out to Amy or I could send to somebody. We've got the short form, there's a longer form that really goes through and maybe makes you think a little bit more about, is there anything, religious, or is there anything, spiritual that I want done? Another woman that I worked with, she had it on her advance directive that when she died, she wanted her body rubbed in lavender oil. And so we had a CNA that kind of was always on call, for the moment that she, when she got close to end of life, and, we honored it. And so when she passed, our CNA went over and was able to, rub her body in that lavender oil. That was something very important to her. So if there is anything important, this would be the perfect spot to include it on any of your wishes. And again, it's not just, it's about life decisions, but it also, it can be anything that's important to you. Like maybe there is, maybe when it's time for you to be, end of life, you want to be wrapped up in your favorite quilt, or, this is a spot where, people are going to have access to it. They're going to have a copy of your advance directive. And so to give your family direction or give your loved ones directions on, how to, going about those things. And then the next form I've got here for you is the PULSE form, and this is a provider orders for life-sustaining treatment. Here is where it would be the do not attempt CPR or the DNR. So you would, just allow that natural death or attempt CPR. Again, this is completed by the healthcare professional and then signed off as a provider. And you'll see, I see this used more on the Minnesota side than we do on the North Dakota side for the PULSE form. But again, this is where the signature of the physician is basically saying and acting in that best interest for that patient. You can also have a healthcare agent, listed on this, but this is just basically more so of your do not attempt, DNR, full CPR, any type of medical treatments that they'd be looking for. So when to review a healthcare directive. So I have always followed and learned about the 5 Ds. So at least every decade. So we would ask that, every decade you are looking over an advance directive. And this would be, I would say this one is more important if you complete your first one, maybe when you are younger. Maybe you turn 18 and you're like, yep, I'm going to do my advance directive. And so maybe make it a point that at year 30, I know it's a little more than a decade, but at year 30, then you can remember that on every, 30, 40, 50 year, you would be able to review it. Now, it doesn't mean that you need to update it every decade, but we just ask that you review it to make sure your goals and wishes remain the same. Or if you've had a decline in health, so you've had a little bit of decline in health, some changes, it doesn't hurt to review your advance directive. If you've got a new diagnosis, and so maybe now you've been feeling pretty good, you've been, living at home, you've been very independent, but now you've got a new diagnosis. Maybe it's a cancer diagnosis, but it's not a terminal diagnosis yet. And so we would just ask that you would review and kind of look at that and say, and think to yourself, now that I know I've got this different diagnosis, would I change any of my wishes? Would I change any of my goals? This one is a death, and this one has a couple different meanings. And so this could be a death of maybe one of your agents. But another more, I think, important one is if you've maybe experienced or witnessed or been involved with somebody that has died. And so you've seen what their death looked like, and maybe you don't want your end of life to look the same. Maybe you've had a really good, you've known somebody who was in a car accident and the outcome wasn't good. And so now maybe it's changed your perspective on what CPR looks like. So anytime that you experience a death or maybe one that was really close to you, we just ask that you look it over again, because it may change your view on your own end of life or what your wishes are. And then if there is a divorce, so that just is, probably your agent is listed on there, could be a spouse. And so again, you don't want to have a previous spouse listed, if making those big decisions for you. So these are the 5 Ds I always encourage people: decade, decline in health, diagnosis, death, or divorce. So you don't need review them. Again, you don't have to update it every time that you look them over. So, all right. So any questions? I left 5 minutes, but I've asked some, as we were going through it. I guess, does anybody have any questions that I can answer, or?
I do.
Yep.
Is that long form for honoring choices online too?
Yes, it is. And so the Honoring Choices Minnesota is a little bit harder to find, Deborah. But what I can do is I can email it to Amy. And Amy, do you have everybody's, their email address that you could get it out to, Deborah?
I do.
Okay.
I will certainly
Yeah.
send it up.
Okay.
Okay. Yep. And so what happened is so Honoring Choices was through a couple of physicians down in Minnesota, down in the Minneapolis area, and they decided that they no longer wanted to house that information. So you can still find it, but I have it saved on my computer, so it's much easier for me just to send it to Amy, then she'll get it to you, versus you trying to find it online. North Dakota has Honoring Choices of North Dakota. It's all voluntary program that's done. There's a website for it. Honoring Choices Wisconsin, they were kind of on the forefront of the advanced care planning, and so they've got a lot of good resources. You'll find that Honoring Choices, no matter what state, will give you really good information, but you'll want to complete the form of the state that you're residing in. So I can definitely get you that copy. I'll make a note of it right now. Any other questions I can answer? I know that's a lot of information. and a lot of, hopefully, I'm hoping that most people have at least thought about an advanced care planning, or at least started putting one together. When I've done this presentation in front of an audience, I usually ask how many people have one completed. And sometimes it's 50-50. Sometimes I get a group that has everybody's completed one, but they just want to know more about it. When I've talked to the younger groups, almost nobody has one completed. And so it's interesting. But I feel very strongly about people having an advanced directive. And I know I've mentioned it a few times that it's just a gift that we are leaving, our loved ones. It's a gift that we are hopefully able, if I'm not able to make my decisions, knowing that there maybe won't be that tension and people can get along when those decisions are needing to be made. And so I got on a side note, if you guys are still thinking of questions. So I've been working hospice now since 2014, and I'm very open and honest. I've been a social worker since early 2000s. And so I've always lived by the motto of, having those conversations with your children and really teaching them at appropriate stages. And so when I'm trying to think, my kids now are 11 and 9. So I would say about maybe 5 years ago, I was running them out to my sister and brother-in-law's house to hang out for the day while my sister and I ran some errands, and we drove by a cemetery. And my son has always been very thoughtful, really thinks of some deep questions. And so he's like, hey, Mom, so what happens, if the cemeteries, get too full? Like, what are they going to do? And so I talked to him a little bit about what cremation was, and I explained, in kid terms, what that meant. And, he was like, so Mom, what do you want? And I said, well, I mean, that's kind of a deep question, for a 6-7-year-old. But I said, I think Mom would want, cremation and and whatnot. And then he kind of giggles a little bit and he's like, how long do I have to remember this for? And so we had a good laugh, and I got out to my poor brother-in-law who was watching my kids, and I'm like, I'm so sorry if my kids talk about cremation and burials. That was our topic of conversation on the way to your house today. But it is, I think it's important to have these conversations and, not be afraid if you've got little kids around to, just talk about what is death and dying, what do funerals look like. My kids are, like I said, 11 and 9 now. And I mean, my son still talks about that. He's like, yep, I know cremation. And, they had a great grandmother that passed away during COVID. And I prepared my kids for like the funeral and talked to them about it. Whereas my nieces and nephews had no idea what they were walking into. And so this kind of a side note of advanced care planning, but, it's just having those conversations. So once your forms are done, make sure the people that are listed on your advanced directives that are closest to you, make sure they know and you have those conversations. They can be tough, but they are so very important.
All right, well, if there's no further questions, then I'm going to stop recording, but I'm hoping some